Treat minor wounds at home. Stop the bleeding. Smaller cuts and abrasions usually stop bleeding on their own. A cut to the head or hand may bleed more because those areas have a lot of blood vessels. To stop the bleeding, gently apply firm, direct pressure using a clean cloth or gauze. Continue to hold the pressure steadily. Clean the cut. Rinse the cut or scrape with cool water to remove dirt and debris. Hold the area under running water or pour clean water over it from a cup. Use soap to clean the wound. You don't need to use stronger cleaning solutions, such as hydrogen peroxide, iodine, or rubbing alcohol, to treat minor cuts and scrapes, as they may irritate the wound. Cool clean water should be fine for cleaning the wound. Cover the cut or scrape. Once the bleeding has stopped and the wound is clean, you should cover it with a sterile bandage or gauze pad and tape. If the cut is small and is in an area that won't get dirty and be rubbed by your clothes, you may decide to leave it uncovered. But for most wounds, it's a good idea to cover them to help prevent infection or reopening the wound. Aloe vera. The use of aloe vera to treat wounds dates back thousands of years. Aloe vera has analgesic, anti-inflammatory and soothing properties. Also, its gel is rich in phytochemicals that can ease pain, reduce inflammation, increase the moisture content in the skin and promote healing. Coconut oil. Coconut oil can effectively heal wounds due to its amazing antibacterial, anti-inflammatory, moisturizing and healing properties. This has been proven by several studies. Coconut oil can also keep infections at bay and prevent scarring. Garlic. Garlic has been used to heal wounds for years due to its antibiotic and antimicrobial properties. It can stop bleeding, reduce pain and promote healing. Also, garlic boosts the body's natural defenses to prevent infection. Turmeric. Turmeric is a natural antiseptic and antibiotic agent that can be used to heal minor wounds and prevent infection. According to a study published in the journal Molecular and Cellular Biochemistry, the curcumin in turmeric improves wound healing by modulating collagen and decreasing reactive oxygen species.